So can you briefly talk about each of these and how the types of diabetes are managed differently?
Sure. So type 1 diabetes and type 2 diabetes are managed very differently. The difference between type 1 diabetes and management is that insulin is really the only treatment that we have for type 1 diabetes, because the problem in type 1 diabetes is an insulin deficiency.
Right.
With type 2 diabetes, there are a lot more medication options. Lifestyle plays a big role in type 2 diabetes management, and so that's where the difference is. We do use insulin as well in type 2 diabetics. When different medications and lifestyle aren't enough, insulin can be added.
Okay, so let's talk more about the blood sugar monitoring. So we think of that, we think of the prick and the finger. So what are the different ways that you can check your blood sugar starting with this device?
Sure, absolutely. So this is a very typical glucometer or blood sugar monitor, and what happens is that you use this thing. It's called a lancet. And the lancet has a little needle in it, and you poke your finger, you press a little button and you poke your finger, and a little drop of blood comes up. And what you do is you take this little strip, you put it in your glucometer, like this. Oh, I just broke it. Do as I say, not as I do.
Right.
And then the blood comes on the finger. You put the blood onto the strip, and then the glucometer reads your blood sugar. So this is the most common way to check your blood sugar. There are a lot of different times of the day that you can check it. We usually tell people to check it in the morning. Fasting is very important. You can also check it before each meal, as well as 2 hours after a meal. And
so more than like 2 times a day?
You can, absolutely. It depends on the severity of your diabetes and how much you're trying to manage it.
So when you say continuous glucose monitoring, that means, as you just mentioned, the morning, before you eat, after you eat.
So you can continuous glucose monitoring is another way to monitor your blood sugars as well. So there are actually little devices that you can put on the skin. It goes right, it has a little subcutaneous catheter. It sits right in the subcutaneous tissue, in the fat tissue right underneath the skin, and it stays on for about 10 days to 2 weeks, and it monitors your blood sugars. There are certain ones that monitor your blood sugars and sends it via Bluetooth to your phone.
Wow.
There are other ones that put on and you just wave the glucometer or your phone in front of the monitor, and it tells you your blood sugars.